All right. Welcome, everyone. I'd like to call this meeting to order. So we don't have any remote people, so we can just skip the second agenda item. So Veronica, could you do the roll call, please?
Councilmember Walter. Councilmember Flynn. Here. Councilmember Haskell. Here. Vice Mayor Hefty. Here. Mayor Taylor.
Present.
We have a quorum.
Great, thank you. All right, the next thing on the agenda is oral communications. So do we have any oral communications? There's no one in the schoolhouse. And don't see any attendees online to ask questions. So I'm going to close oral communications and move into the regular agenda. So we are going to hold interview to appoint one resident to the Board of Trustees of the San Mateo County Mosquito and Vector Control District. And we have Brian, and how do you pronounce your last name? Is it Lau?
Luo.
Luau? Lu, say again?
Luo.
Luo. Okay, great. Well, welcome. Thank you for being here.
Oh, thanks for having me.
So if it's okay with the council, I got from Brian Webb, who's the director of the mosquito vector control, some questions that he recommended we ask. And I was just going to go through them, but all the council members are welcome to ask additional questions as they like. Does that seem minimal? Okay. So Brian, these are questions that I got. This is not a test. You don't have to get every one of them right. This is just to kind of give us a general sense. And it's coming from somebody who knows a lot about it since he's the director. So I thought it would be a good place to start.
Great.
All right. So all right. So I've got, I don't know, let's see, 2, 4, 6, like 7 questions here. And again, feel free to answer these at whatever level you're comfortable with. Like I said, this isn't a test. It's just sort of help us understand your interests and your qualifications. So the first one is, what skills or background do you bring to the board discussions of policy and finance?
Great. Yeah. So I have a background in public health. I'm a physician by training and worked for the Centers for Disease Control, the CDC in Atlanta, as well as the World Health Organization in Switzerland, including several projects related to vector control. So as part of that, we also helped develop policies, as well as had to work under strict project budgets to decide how to run vector control programs in different countries all over the world. So that's one of the things that really attracted me to this role, the ability to also play a role in vector control, but in my home county of San Mateo County.
Right. Great. And I'm just going to look to either side. If you have follow on this question, you let me know. Otherwise, I'll just keep going. Okay. So, okay. All right. Helen, go ahead.
So thank you. Could you maybe give a little bit of some of the, just one example or short, very brief example of one of the projects that you worked on or programs that you worked on with some of those public health organizations that you named?
Yeah, for sure. So one mosquito-borne disease, dengue fever, it's actually a disease which we fortunately don't have in San Mateo County, but we have found the mosquitoes that can carry that disease. Yeah. So at the World Health Organization, a new vaccine came out for dengue fever, and we had to come up with a policy on how to appropriately use that vaccine because it had some limitations in terms of only certain types of people should receive that vaccine. So we developed a policy to provide guidance on which groups of people in different countries should be eligible for that vaccine and which people the vaccine wouldn't be particularly effective for, both clinically as well as cost effective. It wouldn't be cost effective to use it in that. So that was one of the projects that I was able to lead, and we released guidance on use of that vaccine in developing countries.
Great. Thank you so much.
Okay, the next question is, how do you ensure you remain engaged and informed over the course of a multi-year appointment?
Yeah, so one of the things that I really like about this role is the ability to get more involved in public health. Currently, I work at Stanford in a more administrative role, which I love, but I miss kind of the public health aspect of that. So part of this role would allow me to learn from the work of the role, but I would also consult whatever resources or do whatever reading or study up on any particular issues that would help me be an effective representative of Portola Valley on this board. I also love living in Portola Valley and kind of want to be able to give back to Portola Valley just because it's been such a wonderful place for myself and my family to live in. So I'd also just want to be a good representative and bring back any information that would be relevant to Portola Valley and also represent any concerns that came to me from Portola Valley.
Great, thank you. All right, the next question is, are you willing to participate in required ethics, financial, and governance training?
Yes.
Okay. And I can tell you that we all do, and they're a little painful, but they're not too long, so you'll get through them. The next one is, are you able to consistently attend regular board meetings and occasional special meetings?
Yep.
Okay, great. The next one is, are you willing to spend time reviewing board packets and materials in advance of the meetings?
Definitely.
Great. Are you interested in serving on board committees if appointed? Serving on a committee would include an additional time commitment.
Yeah, I'd definitely be interested. I actually had a call with Brian Weber to learn more about this position, and he mentioned the different committees that they've had, and I'd definitely be interested in helping out with those as well.
Great, great. And it's good to hear that you've been doing your homework as well. Okay, and then the last question is, are there any standing professional or personal commitments that would regularly conflict with meeting attendance? And this is primarily the second Wednesday of every month at 6 p.m. Great. Okay, so that's all the questions we got from Brian. Are there any other questions from the council? Judith?
Yeah, two. One is just what spurred your interest in CDC and vector control related items?
Yeah, so in college, I actually ended up taking a year off in the middle of college to go work on public health programs in South Africa. And it was such a life-changing moment to realize the power of medicine and public health to help communities, whether it be in the US or all over the world. And that really changed the trajectory of my entire career. Before that, I was thinking maybe I'll go into a law school or do something related to public policy, but that really changed my interest towards medicine and public health, and that's what I have worked on ever since then.
That's great. The second is, what roles have you played, if any, in public education on public health issues, like a high level overview?
Yeah, so both at the CDC as well as WHO, we would often do webinars, whether that be to local health departments that we had worked with, communities that we had done a project with, or experts in the field providing kind of continuing medical or public health education to clinicians as well as public health professionals. And that's actually one of the things I really enjoyed about that work is being able to take what we learned and give it back to the communities that we had worked in.
Thank you.
Okay. Other questions, Rebecca?
Yes. Thank you, Dr. Luo, for coming. I had a question about what is your understanding about the Mosquito and Vector Control Board in terms of informing the community about the resources available from that department?
Yeah, so while I was considering whether or not I'd want to take on this role, I read through their most recent annual reports, and I learned a lot about the different services that they offer to the community, whether it be coming out and doing checks for people or providing laboratory services when they have to do particular specialized testing around diseases that are related to mosquitoes or other vectors. So I learned a ton about kind of from that. And I'd love to be able to help kind of let other people know about those services as well, because I was really impressed with what they've done. Another thing that I remember reading in the news about like years and years ago is that they had some issues with financial management, which Brian had let me know that they've really kind of cleaned up and are now kind of a model for how to properly be good stewards of kind of public resources. So I was also really glad to hear that as well.
Thank you. And the other question I had is, I know that the department, I believe they test for tick disease, borne diseases.
Mhm.
And there's been a request within the town to also find some department that would be able to test for rodenticide deaths, for the cause of death for animals that we find laying about. And I'm just wondering whether, as you're now getting familiar with this board, with this department, if that would be part of it, or if that's something you lobby with the department to include.
Yeah, I do know that they do tick-borne disease testing, and that was actually part of my medical training as well, to learn how to identify different ticks, as learn how to test them. For rodenticides, part of my medical training was also related to toxicology. I actually don't know yet if they do that sort of testing, but that's kind of an example of something I'd love to be able to look into, because I remember seeing messages in the Portola Valley forums, about people who were concerned about this, seeing, animals that had passed away and wondering if they had been exposed to different toxins or rodenticides. So that's an example of something I'd love to be able to represent Portola Valley on and find more information about.
Thank you.
Okay, Helen?
Thank you. One quick question, and I'm not very familiar with the vector, pest control board. So I'm curious, I used to, when I would walk out on the Baylands, that they would use, spraying. And so I am curious, obviously there are other more natural opportunities. And obviously sometimes it's more appropriate to spray, but I am curious about just your stance on both.
Yeah, that's something that I remember, especially I used to live in Palo Alto before we moved to Portola Valley, and there was active spraying. I think, the Baylands being more in Santa Clara County does a lot more active spraying than what we see in San Mateo County, fortunately, because I would want to see something that is not only responsible, but also kind of the minimal that is going to be effective to control vectors to prevent the spread of human disease. So I agree, if natural options are something that could be considered, I would want to have a conversation about that, but also understanding that sometimes to protect the public health, you need to consider a more chemical type of sprays. And that's actually something that I personally, especially having, young children, growing up in such a wonderful natural environment, that I want to be able to protect, for them for the rest of their lives. And, when they have their own kids, for example, to understand kind of what is really going on into our environment, and to make sure that it's responsible.
Great. Thank you so much.
Mary?
Hi, I'm Mary Hufty. I'm a physician and was at the Palo Alto Medical Foundation. I'm very interested in epidemiology and public health. And I've also always loved the mosquito abatement. So I personally am thrilled that you're doing this or thinking about doing this, willing to offer your extensive experience in it. I guess I'm asking, are you aware of the boots on the ground type activity that they do in our town? And would you be willing to be a spokesman for them and for us in terms, since I've had Creekside property, they have helped with the mosquito situation there, and they've stopped doing it because of difficulties with the relationship between Fish and Game. And I would love to know if you'd be willing to be our advocate on that.
Yeah, for sure. I mean, I think one of the things I liked when I was doing my research about what the board does and what they've done in the past is that they have a variety of different techniques that they use, everything from chemical control to biological techniques to kind of physical prevention of mosquitoes. So yeah, those are kind of exactly examples of things that I would like to be involved in. And also from a personal perspective, I'm one of those people that if there are mosquitoes around, I get bitten more than anyone else. I'm almost like natural mosquito repellent for people. So I'm like, I really don't, want to be able to, I really want mosquitoes under control, I guess is what I'm trying to say.
Yeah. Thank you.
Okay, well, thank you, Robert. So with that, I would entertain a motion to appoint Robert to the mosquito and vector control district? Oh, that's a good question. We had oral.
So technically that prior item was public comment, but I do see now there are folks in the schoolhouse, so you could just check again.
Are there any hands up? Let's see. Yeah, I don't see any hands. So with that, I would entertain a motion to appoint Robert. Thank you. Do I have a
Second.
Great. All right, all in favor, say aye.
Aye.
Aye. Congratulations.
And
Great.
thank
so
you.
much.
Thank you.
Thank you so much.
Yeah, thank
We're
you.
here for you if you need solace.
Thank you so much.
Well, and I was also gonna say, come down some Wednesday night and just introduce yourself in person. But we're very happy. You seem super qualified. And I think we're lucky to have you on the board representing us. So again, thank you for applying and let us know whatever else we can do to help you.
Great. Thank you so much for your time today.
You bet. Good night.
Take care.
Okay, so now our next item is a meet and greet with Captain Brandon
I think you
Hensel.
can come.
Well, yeah, I know he's here. We can go get him.
Part of the,
Yeah, this is just a meet and
Okay,
greet.
fine,
Then he's going to do a
fine.
little bit more. This is just,
okay, fine.
so, yeah, so this is more, I think we can just kind of get up and say hello to him, right? So. And then we'll have the more formal part later. This is just, we had like kind of.
Oh.